When patients go to a physician and they actually get a plan of care that tries to address their pain problem, the doctor should tell the patient that they need to monitor what's going on and they need to keep a record so that they can bring that information back to the physician. And many things have to be tracked. The patient has to be aware of what's happening with the intensity of the pain over time. They also have to be aware of what medicines they're taking over time. They also have to be aware of how they're functioning over time, and that may include how much they're walking, how much they're out of the chair, how well they're sleeping at night. They may need to track other symptoms, like how fatigued they are, for example. And doctors often assume that patients' memories at the time of a visit may not adequately represent what's going on. So to address that problem, some doctors, and particularly pain specialists, like to tell patients to keep a diary, a pain diary. And some of these diaries have been published on the internet, but frankly, the diaries are not so sophisticated or complex, and anybody can create a diary. The patient just needs to indicate what the date is, typically indicate whether the diary is being filled out 2 times a day or 1 time a day or 4 times a day, and then to indicate specific things that are happening at the time that the diary is completed. What's the pain on a 0 to 10 scale, where 0 is no pain and 10 is the worst you can imagine? How would you rate the pain at that time? Are you out of bed at that time? When did you take the medication in relation to that time? Are there other symptoms at that time? And then that diary can be brought to the physician, and in just 1 minute, the physician can see what happened during that whole period of time and get a sense if the patient is making progress or actually doing more poorly.